And hi to everyone. Not sure who is with us, but I did see the list, and so there's a lot of people that I know, and just want to welcome all of you who know me already. But for those that don't, I'm Anna-Mai. I'm the co-CEO of Chance for Childhood, and I'm really excited to be here today with Julius Mbaluto. I've just been training his name, so hopefully I pronounced it correctly. And we're really talking about what is obviously a critical subject. I mean, keeping children safe in whatever normal times are was hard enough, but what has COVID meant for us as Chance for Childhood and for, critically more importantly, our local community partners? So I look forward to exploring this more, and thank all of the participants for joining me, and I'll hand over to Julius now. Thanks so much, Julius, for your time today.
Good morning or afternoon, depending on which country you are. Welcome all on board, and it's a great opportunity to explore these issues all together. Yeah, as we have spoken on the panelists, I'm with great people who have been doing a lot of work. So when they speak, they definitely will be speaking with great authority, because this particular subject, they have done a lot about interactions with children in different times, just not during COVID, but even before that time. So on the panel, I'm joined by Liz Mnengwah. Liz is Head of Programs and Safeguarding Lead at Glance House, Kenya. Liz is at the forefront of delivering child's rights and safeguarding training in-house and to key stakeholders, and developing Glance House reputation in these areas. Another great personality on this, we have Ritah Nansereko. She's the Executive Director of a local humanitarian organization, African Women and Youth Action for Development, AWYAD. And she's also the chairperson for Chance for Charter for Change. Charter for Change. This afternoon is catching up with me there. Charter for Change working group in Uganda. Ritah is also a member of the steering committee of the National Humanitarian Platform in Uganda. She's also a member of the steering committee of the National, oh, what happened there? She is a member of the steering committee of National Humanitarian Platform in Uganda, a member of African NGO Council, and a member of the Global Localization Workstream for Grant Bargain. And the next on the panel, we have Eric Ngabo. Eric is the advisor to the Executive Director at the Empowering Children with Disabilities, a Rwandan local NGO working towards empowering children and people with impairments and facilitating their full socio-economic inclusion in the Rwandan community. So you can see almost every country here we are getting covered. And next we have Vicky Ferguson. Vicky has worked with homeless children and young people in Kenya and the UK. Since 2005, Vicky is Chance for Childhood's Global Safeguarding Lead. And the last on the panel, another great personality, Anna-Mai Andrews. Anna has committed to last 18 years to working with vulnerable children. Since joining Chance for Childhood, Anna-Mai has led organization through successful rebrand and merger, obtaining 200% increase in income and winning the collaboration award at the Bond International Development Awards 2017. There you have it, great people who have done so much work for different societies, different communities, Africa, UK, Rwanda, Uganda, Kenya. So yes, we have a great panel with great personalities, people who know what they are talking about. So we are going to join into a great conversation with them. We want to explore this issue further without wasting any more time. And my first question is to you, Liz. We've seen the challenge of COVID-19 and you are dealing with children. Could you at least, start by telling us the challenges probably you have seen faced by children during this time. And I'm talking about Liz in reference to Glance House Kenya.
Thank you so much, Julius, and hello everyone. Thank you for joining us. It's an exciting moment to just talk about what is happening in Mombasa. And I'm humbled to just represent the children and my colleagues who I work with. And straight to the question, during COVID-19, we have seen a lot changing, both in the community and in the streets, considering that we work with children, both in the streets, in the juvenile justice, and also some in the community, because there are those who have come out of the streets and we're still supporting them. For those who are in the community living with their relatives, we've had a lot of cases of abuses coming in, and we've had to make very quick decisions at some point to provide emergency shelters because they couldn't stay with their families anymore. And the dangers they were exposed to, the risks they were exposed to were just life-threatening. And we really had to do something very quickly. So that is the part of the community. But in the street, we've seen a lot of children as young as 6 months, a 20-year-old woman pregnant with a 6-year-old girl. We've seen girls and boys 12 years. So they've all been going to school, sometimes late last year, sometimes early this year. But with this situation, everything has turned upside down. The situations have been hardened. The parents have just been threatened in a way they can raise income. And so the only option they have had is to run to the streets. Either knowingly or unknowingly, they're exposing their children to a lot of risks. And every day is coming up with with different challenges. So our street work, every day, we are seeing the same children, but being exposed to more damaging risks in the streets. And it's disheartening to see that. But again, it's a pleasure to be there, because if all the other people are not there, including us, then I think the situation will be very, very bad for them. So they're exposed to prostitution for the young girls, they're exposed to drugs, they're exposed to just sleeping in the cold, they're exposed, even their lives, I think they're just in a big risk. Most of them, they will lose out on their dreams and to fight for that education they so love. Yeah, thank you.
And just a quick one. Have you succeeded very much in handling this? Has it been successful or still challenging?
It's still challenging, but yes, we have been successful in a few cases because of the resources we've had, because of the few networks we've had. So yes, it has been successful, but I cannot say that it's not challenging. It's challenging us every day. And you're not sure whether you're doing the right thing or not. At some point, you have to handle the family, including the young children. It's a new approach to work with families and their children on the street. So yes, it's been successful, but again, challenging.
Thank you very much, Liz. We'll quickly go to Ritah. Ritah from AWYAD. Could you just tell us, risks children and women in refugee settlements are facing in light of COVID-19?
Thank you, Julius. It's my pleasure to join this wonderful conversation today. I've already been introduced, and the organization I work for does the development and humanitarian work. And today, in light with the conversation, I'm going to have some in-depth of the work that we do and the risks that our refugee children and women are facing in Uganda today. In line with the humanitarian work, the organization has been responding to the protection needs of vulnerable refugee children since 2015. And currently, AWYAD, which is the organization I serve, is offering humanitarian services on prevention and response of sexual and gender-based violence, child protection, promotion of education in emergencies, which also includes hygiene promotion with special focus on girls' menstrual hygiene management. AWYAD also promotes psychosocial support among refugee children, teachers, parents, and caregivers. We are working in 3 settlements currently that are situated in both northern and southwestern parts of the country. In line with COVID-19, the pandemic has caused a social, culture, and economic plus psychosocial impact on the lives of the refugees, especially the women and children, who contribute the biggest percentage of over 80% of our refugee community. The way of life the refugee settlements make, they live is very problematic in line with adhering to the public health measures, since they entirely depend on aid and host community support. Therefore, things like social distancing and limited movements and all that safe spaces which have been closed can really hurt them and their way of life. There is also an issue of risk communication. The limited translated information about the pandemic of COVID-19 and increased awareness, which is lacking, plus the prevention measures among the refugee communities has also affected them, coupled with reduced services due to the repatriation of some of our international staff back to their countries. There is an issue of inaccessible and very expensive personal protective equipment. This has made it almost impossible for the refugee women and children to engage in community activities that promote their well-being. Children's best COVID-19 prevention measures are very limited, and a priority has been always given to adults, and being from a male-dominated community, men are more privileged to get the services first. Currently, the refugee communities have been faced with a double catastrophe, as mentioned above, of being forcefully displaced and the current COVID-19 pandemic. This has led to a sharp increase in levels of vulnerability caused by reduced protection response services due to diversion of resources to COVID response. We also have limited movement, causing lack of access to social services and closure of schools, among others. The existing guidelines due to COVID-19, especially the closure of schools and safe spaces, has exacerbated the already worse situation of safeguarding among the women and children and girls in the refugee communities. For example, we are actually experiencing a very sharp increase in child marriages and child pregnancies coupled with unsafe abortion among teenage girls. This is because the schools that were once serving as a safe space are now closed, leaving the young girls fully into the custody of the perpetrators and the would-be perpetrators and potential perpetrators. For some families, they have actually resorted to marrying off young girls for bride price as a coping strategy for the increasing poverty among the refugee communities. There is also a significant reduction in aid services. For example, the food rations given to the refugees of recent were cut by 30%. The fact that has exposed women and girls to start risk behaviors or bad coping practices like transactional sex to cover up the gap. We have also the weakening community protection structures. Maybe to say in our refugee settlement, not like other camps in other countries, we have a free movement model for the refugees, and refugees live side by side with their host communities, especially in the northern Uganda. And so their safety and protection can only be guaranteed by the existing strong community structures that can protect them. So we are experiencing them being weakening because of the lack of funding, and this has as well weakened the referral pathways, which were formerly used by the survivors to report their cases for management. This has led to self-withdrawal by some of the community members, especially women, because of less hope for proper management of their cases. You will find out that when a survivor reports a case and later it drops before it is fully managed, there are high chances that the perpetrator can take revenge for being reported. Therefore, we see that once the survivors are not guaranteed of a complete management of their cases, they refrain from reporting and choose to die quietly. The current situation has also brought about an increase in child labor, especially among the vulnerable communities. Children are being forced to fend for their families. Remember, in the refugee settlement, we also have child-headed homes. Because of the reduction in response services, they are now forced to go and fend, the fact that they're out of school. Since the fact that has increased abuse of children's rights among refugee communities. I think those are, I'm sorry for taking long, those are some of the safeguarding issues that I can point out. Thank you.
Fantastic. I don't want to add anything to that. It's very clear. And thank you very much, Ritah. That's a brilliant explanation. And of course, yes, wow, what a challenge that is posing to this group of people. On the next issue, we want to explore the plight of children with disabilities. And we have Eric Ngabo. And Eric is working with, runs Nyabihu Deaf School, and also, of course, he has first-hand experience in these issues. Eric, would you maybe tell us, you know, the challenge you see being faced by children who are differently abled?
Thank you, Julius, for giving me the time, and allow me to begin by thanking both Chance for Childhood and everyone here present for making this session possible, because it's a very important and interesting session to have. First of all, as everyone knows, COVID-19 has had terrible consequences on everyone around the world, but this impact and the consequences have been much more devastating to children with disabilities. As Ritah said, my colleague in Uganda said, schools, most of the time, for vulnerable groups of people and children especially, schools are safe spaces for them. I mean, we have safeguarding policies, we have mechanisms that are strong enough, and we have our staff who are dedicated and trained to make sure that children are kept as safe as they can be in schools. But most of the time, these mechanisms cannot be applicable out of school. And as many of you may know, since March 14th, schools across the country here in Rwanda are all closed, including our Nyabihu School for the Deaf. So that means that our children are exposed from March until today, and they might not be able to return before next year. And that is a very, very long time to be away of school. That is a very long time to be away in a community that does not understand safeguarding, really. So we have made an assessment and found out that the most threatening threat that these children of ours are facing is, I would say, sexual violence or sexual abuse. Because last year, the National Institute of Statistics of Rwanda, 17,337 teenage girls were impregnated in only 1 year. And if we put it into our school's context, we have 30 girls, of whom 21 are aged between 13 and above. That means that these 21 girls are exposed to people out there in the communities who might abuse them sexually. And according to another local NGO called Rwanda Men's Resources Center, 20% of these teenage pregnancies these abuses were done by family members or family friends of these teenage girls. So you can understand how a threat this is to our children who are not at school since March. Another threat.
I ask you, have you maybe seen the government having an effort to combat this problem? Is there anything that has been done?
Absolutely, the government has is at the forefront of this fight because the legal framework has been changed, and the penal code has introduced very heavy punishments. Because, for example, if you rape an under 14 girl here in Rwanda, you would be subject to life imprisonment without parole. If you did this to a girl who's between 14 and 18, you would be subject to 25 years in prison. This was not the case 2 or 3 years ago because the punishments were quite not as harsh as they should be. Also, there has been a number of lines set up to report any sorts of cases, but then still we are still worried because we have had 17,000 cases, but we have not had 17,000 rapists convicted. So that means that there are still rapists who are out there in the communities and who might harm our children. Another threat is basically neglect due to heavy disruptions, financial and economic disruptions that families are facing. We are fearing for neglect of our children. We will have definitely our children will come back having faced a number of these issues that have to do with neglect. But on the other hand, I would love to thank Chance for Childhood for having been at the forefront of ensuring that we can actually intervene to reduce the impact of this. And every child's family in our school have received enough food for 6 weeks, and every family member has received enough personal protective equipment in the context of trying to curb COVID-19. So that is what's happening around. And as you all can imagine, we have had disruptions caused by COVID, but this is nothing compared to what children with disabilities are facing or are threatened to. Thank you.
Thank you very much, Eric. What a challenge that poses. We hope, the solutions will keep emerging. Our next on the panel is Vicky. Vicky, your role as Global Safeguarding Lead. Of course, you've been working with partners and supporting them during this time of risk. Could you just tell us or, take us through that, especially what you've been doing?
Of course. So I started on the 1st of April, so as we were already in the pandemic. So it was sort of really thrown in at the deep end but in a really sort of great way, because it meant that I had to reach out to partners really quickly and understand what those safeguarding issues and challenges look like during a pandemic. This is an unprecedented time for practitioners. We've never had to try and keep children safe in a situation like this globally ever. And what was clear is that there were key themes. We had a call with all our partners, and there was key themes coming up in terms of keeping children safe. So we created a community of practice, which is basically a load of practitioners coming together and sharing ideas, challenges, thoughts, resources. We have a group of partners who are experts in their field. What they do, we've just heard what they do. It's absolutely incredible and inspirational, but they're also overworked in a pandemic where they don't have the time and space to respond and find all the things they need. And what we knew is that there was a wealth of resources being created by big safeguarding movements and child protection movements and protection from sexual abuse and exploitation movements. And loads of resources were being churned out. So what we've done is we've taken some of those, shared them with partners, gone through them, looked at how we can adapt those resources to the settings that partners are working in. So we've looked at managing cases remotely. How can we keep children safe when we can't see them? So how do we do that over the phone, online? We've looked at one-to-one resources in terms of managing anxiety and fear and mental health around the pandemic, and the feelings that those children and young people and adults at risk who are back in their communities or in a refugee camp or on the streets might experience, and helping to manage those anxieties. And we looked at that, you know, remotely and face to face. And actually Anna-Mai's mum came and did a session on mental health with us around identifying key mental health issues and how we can manage those, particularly in a pandemic. So it's been a real, it's been an amazing, something wonderful has come out of a terrible, terrible situation, in that we have managed to bring these incredible inspirational practitioners together and share challenges and solutions, most importantly.
Just to get this very clear, if, for example, we are dealing with one incident and it's been reported to you, how does your role handle it from beginning to the end? And are there any challenges that comes within you handling it?
I think that's probably best answered by Liz or Eric or Ritah.
Okay, no problem. Yeah, no worries. You come back to, probably people will come back to you later, but let's go to Anna-Mai. In terms of best practice safeguarding in all your work, how does that work?
See, I was going to fire that one back to you, Vicky.
Like a football machine.
Yeah, I mean, best practice. I think the struggle that I've always seen in our sector is that we have a lot of focus on policy. And we have a big focus on people ticking boxes for donor commitments. And because of the pressures that everyone's already talked about, we don't go beyond that. And I think what's been really great about the last 6 months, and particularly in terms of the challenges that COVID has put upon us, and the threats, and having Vicky on board to actually just take a deep dive and look at like continuum of best practices, as Vicky likes to talk, in terms of like, how can we look at this, what actually works in the context that we are working within, because Liz and Eric and Ritah, they all work in very different contexts. So if we as Chance for Childhood are to impose a specific safeguarding approach, it's not applicable to the environments that they all work in. So I think you've got to be very flexible and agile and adaptive and inclusive. And I think that's the problem with a lot of the safeguarding approaches, is they don't think about those very vulnerable children that Chance for Childhood really tries to represent always. You know, if you're deaf, and you know what Eric was talking about in the justice systems, you know, if you are raped and you're deaf, you don't have access to an interpreter by law in the Rwandan courts. There are so many challenges within the law and in the actual practice of trying to get these abuses you know, withheld within a proper system. Yeah, I don't know if you want to add anything, Vicky.
Okay, thank you very much, Anna-Mai. Because of time, we are going quick to hand over this session to our those who have also joined us with different questions. And I'll quickly, because yeah, a lot have been spoken, it's very clear. So whoever has a question, just we are going to deal with questions now, and I'm going to hand over to you, Anna-Mai. No, not yet. I'm going to hand over to Vicky to tell us what questions we have.
Yeah, well, while they come in, Julius, because people are still sending in questions, I just wanted to sort of pick up on Anna-Mai's point a little bit about what we're doing, and sort of in terms of the webinar and the focus in September, which has been on the Survivors Support Fund that we're fundraising for. And sort of acknowledge the generosity of our donors and supporters, because I think when we sort of chose to crowdfund for safeguarding, I mean, that's not, you know, I was really nervous, because I think safeguarding, it's something people are uncomfortable about talking, because it is really, really challenging stuff that we're talking about. We're talking about, you know, the violation of children and young people and at-risk adults. And most people, you know, that's such a challenging thing. And it's been amazing to see people's response to a fund where our partners like Liz and Eric and Ritah and everyone else can access that fund to support you know, children and people that have experienced things you would never wish on anyone. And, you know, sort of following on to Anna-Mai's point about, you know, these are, our partners are working in systems where there aren't the adequate social care systems to support children and young people often. And so reporting abuse is so challenging because the pathways aren't there to seek justice and to seek support after, you know, whether they can seek justice or not. And so, you know, I've worked with Liz for a very long time and seen the abuses that street children face it's shocking, and it's the people that should be protecting them that are abusing them. And this fund means that those children and young people can access the support that they need to deal with these abuses, but also can, the practitioners, and I really want to stress this because I wrote a blog about this week, and it's really something, you know, these people that we hear from today deal with things that are unimaginable because of the stress and the pressure of getting it right and keeping children safe. And we'll also be supporting those practitioners through the fund as well. And that's something I'm really passionate about, is ensuring that social workers have adequate support in unbelievable tough situations like we've heard. I mean, and so that's a really important part of what Chance for Childhood are doing in terms of safeguarding right now in COVID. I've got a question now, sorry.
Yeah, I wanted you to go through the questions.
I was waiting for them to come in, I was filling.
Okay.
Patience asked, hi Patience, keeping in mind that children are vulnerable, how can we best try to protect them and minimize the exposure of children on the streets and in refugee camps? So that's for Liz and Ritah, I guess.
Thanks, Vicky. I'll answer the parts and then I'll let Ritah do the other parts. So thanks, Patience, for your question. And I'll say this because the schools are closed, the children are exposed right away from home to their communities, their friends, the gadgets they're using. They've never used some of these gadgets, but they're learning them in different ways in so many places. They can't go to church, they can't go to school. So for those who have got guardians, or for guardians who can see the exposure the children are undergoing, then I really like to create an awareness whereby the adults themselves are able to protect these children. It doesn't matter how, but you just have to make an effort to protect these children, because if the damage happens, then it's going to live with this child forever. It's a trauma for life. So, and getting that trauma is going to be expensive and even might cost that child their life. So for the guardians, let them be on the forefront to protect the children. For those on the street, I mean, for us, we are trying to create safe spaces. My colleagues have talking about safe spaces. They're being limited. We can't do our programs as we used to because of social distancing, because the government has its own regulations. But still, we have tried to adapt a few things so that we can be able to meet them. So we are creating small programs in the streets so that we can meet different sessions. We can have a number of sessions. That means a big group of people are spending time on the streets. At the same time, we are trying to be using the resources we've been getting from Chance for Childhood sessions, and we've created a lot of child-friendly flyers, and these have been very, very effective, both for the workers and for the children as well. So for them to just sit and do some coloring or just talk about themselves in drawing or doing something, again, that has really helped us for a lot. So for those on the street, that's, if you can contain a child for 30 minutes or an hour, trust me, that child is safer than if you're not there. Thank you.
Ritah, did you want to answer that as well?
Yeah. Okay, thank you. I think Liz has really hit on some very important points there. Just to add, what we need to do in a refugee settlement, for example, I think we need to strengthen the referral pathways such that the communities are safe and are able to respond to the key issues of safety and protection of the children and women as well. We also think about if we expanded more and constructed more safe houses so that we can actually have the social distancing practical wherever we have established them, because we cannot afford leaving these children under the culprit's custody. AWYAD has embarked on a training on reusable masks. With the fund that we received from Chance for Childhood, we realized that PPEs are quite expensive and we need to adapt the local knowledge. So we have trained women and children, teenagers, to make their own reusable masks. This has saved us because the resources are minimal, so we have to be cautious and reach a bigger number. Yes, also supporting the psychosocial well-being of parents and caregivers, especially for the refugee communities. They are also vulnerable, so we need to prepare them and support them such that they can also give the support in return to the children. Thank you.
Eric, did you want to chip in at all?
Thank you. The question didn't really touch base on our context, but I would also like to say that we need to ensure that parents are as trained as our staff are, because we have seen this COVID pandemic strike, and we never know, something similar might happen in the future. So I think that we need to make sure that our children are as safe as they can be when they're at home as when they are at school.
Great. I've got one more question here from Peter. Hi, Peter. Would you say, this is a massive question.
Peter Musembi.
Peter Musembi. Would you say the COVID-19 pandemic situation, this is me trying to read without my glasses, sorry, situation now calls for change or update in policy by governments, organisations or institutions to better safeguard children when such unforeseen circumstances strike again? Mega question. Anyone want to answer?
I'm sorry, maybe I can give a small hint about the question in line with localization and the current situation in the refugee context. Of recent, we have been experiencing NGOs offering the majority of services for refugees in Uganda, and the local community who are the hosts and local organizations like the organization I serve have always been left at the periphery of the services to give to these vulnerable people. So when COVID hit, you realize that majority of the INGO staff who are international had to repatriate back to their countries. So we are calling upon all the signatories of the Grand Bargain to make commitments come to reality by embracing localization, having the local community respond to global challenges, because local communities are there to stay, to deal with the uncertainty. Thank you.
Thanks for making that point, Rita. I think that is the fundamental behind it, is a shift in power and shifting the power to local community-based organisations. And yes, for me, it's a definite yes, there will be needed. There are a lot of changes needed for that to happen in INGOs, in governments, but also in terms of the transfer of money, because we can't forget that it's all about power is held within the donors, especially with big donors, particularly in terms of how that money is handled and transferred, and how those relationships are built to be mutually balanced and of equal power if you are in a partnership. So those are critical questions that we're asking a lot, and more to follow on that in due course.
I also would sort of on a local and national level that we have to recognise that the children and young people that our partners support are the forgotten children and young people within societies and communities, whether that's children living with disabilities, children living on the streets, children in prisons, children in refugee camps. And so we have to support our partners, or we have to start lobbying at a local and national level that these groups of children are included in policy and included in protection networks, because right now that they're forgotten because they're too challenging and they're too hard to reach. I hate that term, but and so if COVID's shown us anything, is that the most vulnerable children are the most forgotten, but yet the most in need. And so we must start lobbying at local and national levels to ensure that this never happens again, where, you know, like Glad's House Kenya, for example, we're out on the streets ensuring that children didn't starve to death because there was no response to those children in any policy.
I was going to say also in terms of practice, and Anna-Mai was talking about practice. And for our experience in Mombasa, we have realized that, yes, the government is there. There are very good policies. Yes, not for COVID, of course, but in terms of general practice of working with children, then most of the officers are far from the reality. So I'll also look at how the government can invest in making sure that the officers, or rather all the sectors working with children, they really have not just the policies, but also the practice. They have the capacity to work with children, because we've seen a lot of local organizations, they're working on the streets because of their own reasons. But when you visit the children, because how they work with the children, then it's really, really shocking. So for me, I'll also campaign for big investment in just capacity and practice, if at all anyone has to work with children. Thank you.
I don't think there are any more questions from anyone. I'm just checking. No.
Well, that being the case, I mean, it's just a fantastic afternoon as we explore these issues, and they mean quite a lot to so many people. So with that in mind, I think we now see why we need to engage with Chance for Childhood and continue these conversations, probably to come up with better and much better information to inform policymakers wherever they are. When they formulate policies, they begin to think, oh yeah, I heard this and that, and we need to take it on board. So it's been a very fantastic afternoon. Thank you to all our panelists from all corners. And also thank you for, also the questions you've raised. They are also very useful to these conversations. And I will also, I hand over to Anna-Mai for last closing remarks, to also alert you that there's a poll on online that you can tell us your feedback. So when you see it, just, go and really fill out what you want to fill out there. So yeah, I'm going to hand over to Anna-Mai for closing remarks.
Yeah, I mean, just to echo, big thanks to everyone who participated in our community partnerships, which all of you, we couldn't do this work without you, and you know what is best for these children in your communities. And equally thanks to everyone who's listening in, who cares about these children, and we really care, and we don't always get it right, and we are learning in this environment, and we will continue to reflect a lot on all of these challenges. And one thing I can tell you is that we will do our absolute best to continue to be there. Thank you.